So good afternoon, everyone. It's a pleasure to be here for the final conference of the Interoperate project. So here my task today will be to present you the picture from the policy side, what the Commission is proposing at European level when it comes to data sharing and data access for patients, but also researchers and policymakers. So just to give you some background, so what the Commission is trying to address as major issue that we are currently facing. So on one side, so I will address both the primary use of health data in context of healthcare delivery and the secondary use of health data for research, policymaking, and other regulatory activities. So what we could observe is that individuals have difficulty accessing and having control over their data. Similarly, also healthcare professionals have difficulty to have access to the data of their patient because it can be held in different places, in one hospital, in another, with some data or with the, for instance, general practitioner or with specialists. So the data are scattered and not everything is centralized. So then we have, in terms of secondary use of health data, we also see that policymakers and regulators have difficulty accessing data. We can see that in terms of, for instance, for medicines, for example, the European Medicine Agency needs data to perform its activities. So this is a point that we are trying to address also with the proposed regulation. And also limited research and innovation takes place on the basis of health data because it's burdensome to request access to health data in many cases. And the last point is in terms of provider of digital health services and products, they also face barriers to enter the market. So this is the reason why the Commission adopted in May 2022 proposal for regulation on the European health data space. What is contained in this proposal? The proposal contains rules, common standards, infrastructure, and the governance framework for the use of health data, both in the context of healthcare provision, but also for research and policy-making purposes. So the three objectives are summarized here. So one, and probably the most important one, is to empower individuals to get access and control over their personal health data. The second point that we want to address is to foster a genuine single market for digital health services and products. And on the side of the secondary use, it's to ensure a consistent framework to improve the use of health data for secondary purposes. So, we are not building from scratch. We are taking into account other legal proposal or legal framework that are already in place. So, for instance, the EHDS proposal is very much building on the general data protection regulation. So we want to go further in some aspects, but we are not putting into question the data protection rules that are in the GDPR. Then we also take into account the Data Governance Act and the Data Act, that are currently discussed in the Council and in the Parliament. And here again, we provide tailor-made rules for the health sector. I will go back to that later on when, for instance, I will speak about data altruism. Then we also take into account the EU cybersecurity framework, and we complement, for example, the NIS2 directive And we also take into account existing legislation, for example, on medical devices. Sorry, I'm a little bit sick still. And artificial intelligence. So, and the EHDS aim to be one of the pillars of the European Health Union and boost the work of other EU policies such as the EU Cancer Plan and the pharmaceutical strategy. So what is the scope of the EHDS proposal? I already mentioned it briefly. On one side, we cover the primary use of health data for healthcare delivery. So here, there is one important focus on the need to empower individuals to have access and control over their data. One of the tools that is mentioned in the EHDS proposal is the European electronic codex format that will be established. The recommendation from Commission, but we want to go further and to have it implemented to allow the data to be shared, for instance, between one healthcare provider and another one. And then there is a part more related to the products with the certification of electronic health record systems. Here, we want to have essential requirements on interoperability and security applicable to all electronic health record system processing specific categories of health data. And then a voluntary labeling for wellness applications. So in this case, it will be up to the manufacturer. If they want to claim interoperability with electronic health record system, they will have the possibility to have a voluntary label. And an infrastructure that is already existing, so My Health at EU, and we want to make it mandatory for all member states to take part in this infrastructure for primary use of health data. And then the second part is related to the secondary use of health data. Here, the EHDS proposal establishes health data access bodies that will process application and provide data permits for data users that will be able to reuse data for secondary purposes. I already mentioned research, innovation, regulatory purposes, and also policy making. So the EHDS proposal foresees purpose for which it will be possible to reuse data and also forbidden use. For example, insurance, to increase insurance premium, it should not be possible to use the data for that. And then one point I wanted to mention is also the fact that data will be processed within secure processing environments that will comply with specific cybersecurity rules. I will mention it later in more details. And last point I wanted to mention is another infrastructure that will be set up for the secondary use of health data. It's health data at EU. It's the same, a similar approach that is taken for secondary use than the My Health at EU that is already in place. Okay, so here, I mean, I will not go into the detail because I already mentioned several points that are mentioned here. So a focus on the rights of individual. I will go deeper into this in the next slide. Then it will be supported by the fact that electronic health record system will have to comply with interoperability and security requirements and be certified. The rules and mechanism for the support of secondary use of health data and all is supported by two mandatory infrastructure for primary and secondary use of health data. So My Health at EU and health data at EU. So I don't know if you're familiar with My Health at EU. It was already mentioned this morning. So it's cross-border infrastructure to share health data for the purpose of healthcare delivery. It's already in place. There are 11 member states that are participating in these exchanges at the moment, but most member states have plans to join MyHealth@EU by 2025. So currently the two services that are provided by MyHealth@EU are e-prescription and patient summary, but it will be extended to other categories of data, such as discharge report, medical images, and other. And there is also the pilot. There will be a pilot project on patient access to data. I think it might be raised later on by Zoltan, maybe. So we see currently that more member states are joining, and they are starting to exchange e-prescription and patient summary, and hopefully we will see very soon that new services will be available. So here now I will go in more details on the rights of individual towards their health data. So it's for those that are aware, it's Article 3 of the EHDS proposal. So what is included is for patients to have the right to access their health data in electronic format immediately and free of charge for certain type of data that are mentioned in the regulations. So we are not targeting all health data that are available, because from an interoperability point of view, we cannot go for all that to make all data available electronically in the first place, but we have selected specific categories of data for which, the work have already started. And for instance, as a first step, it would be patient summary and e-prescription, and after that, other type of data that will be shared and be accessible to patients. Then we foresee that data should be issued, transmitted, and accepted in a common European format. I mentioned previously the European Electronic Health Record Exchange format. So we want to implement that for the different categories of health data that I mentioned previously. So another important point is that the EHDS proposal foresees the possibility for the patient to share their health data with other health professional or health provider, using, for instance, the European Electronic Health Record Exchange format. Then they will have the possibility to add information to their electronic health record, but also to rectify errors if needed, to restrict access to part of all their health data, and also to have the possibility to know which healthcare provider or health professional has access to their health data. Sorry. So a point I also wanted to mention is that what we foresee is for member states to put in place electronic health data access service, either at a national, regional, or local level, to support the rights that are foreseen in the EHDS proposal. Then, if we speak about secondary use of health data, I wanted to make a focus on data altruism in the health sector. So here what I summarize is that the concept is not specific to the health sector. The Data Governance Act is already mentioning that there are already some requirements, general requirements on that. But with the EHDS proposal, we are going further by adding a requirement related to the fact that when data are processed in the secure processing environment, it should comply with the rules that are set in the EHDS proposal regarding secure processing environment. Why do we add that? Is to ensure the same level of security as in the environment that is provided under the responsibility of health data access bodies. So in summary, what do we expect as benefits for the different stakeholders? On one side, for individual, as mentioned previously, to gain access and the possibility to share their health data with other health professional or healthcare provider, to have more efficient healthcare, to avoid unnecessary tests within a country, but also cross-border, to support medical decision and to improve health outcomes. For healthcare providers, it's to improve also decision-making, provide better care, but also to allow hospital savings. But what we also see is that we could have benefits in terms of improving telemedicine and telehealth cross-border. This is a point that is mentioned under the My Health at EU. Currently, it's not foreseen, but this is a development that we could consider in the future once the proposal will be adopted by the Council and the Parliament. Then, when it comes to researcher, policymakers, and regulator, for them, the benefits will be to have access to more data, to take better decisions, and to improve research and development activities. And finally, for industry, they will also get access to larger amounts of data to support research and development activities, and also to have larger markets for EHR systems. Then my final slide would be about strengthen security, because one of the key points is to ensure trust in the system, to ensure that patients are confident about sharing their data. So here, what we are showing is that for both primary use and secondary use, there are specific provision and processes that will be put in place to ensure that the level of trust is sufficient enough. So if you take primary use, for instance, there are already, but there will be also security audits for My Health at EU infrastructure. So it's called compliance checks. So before exchanging data, the different contact points at national level are undergoing a third-party audit to make sure that they are complying with cybersecurity requirements and other security requirements. Then there will be strong authentication for patient and health professional, and only the person that will be entitled to access the data can get this access. And then on secondary use, we also have specific provisions to ensure security. So what I can mention is that, for example, user cannot be identified. So the data will be either anonymized or pseudo-anonymized, depending on what is needed, for example, in the context of a specific research. No personal data can be downloaded, and the data will only be processed in secure processing environments. And similarly to what is done for My Health at EU, there will be audits for the My Health at EU infrastructure. I think this was my last slide.
Wonderful.
Thank you.